Nigerians have called on the federal government, the Nigerian Medical Association and other relevant stakeholders to immediately set up mechanisms to checkmate the activities of quacks in the country's healthcare system. Their call is coming on the heels of the recent arrest of an alleged medical doctor identified as Noah Kekere in Jos, the Plateau State capital for organ harvesting. Clarice Gloria Atta has details of the report.
Recently, news began making the rounds of the arrest of a medical doctor identified as Noah Kekere for alleged organ harvesting carried out in his hospital in Jos, the Plateau State capital, following a complaint by the husband of the victim, identified as Alhaji Kamal, to the Nasarawa police station in the state. Alhaji Kamal had accused Dr. Kekere of harvesting his wife's kidney in 2018 after she was diagnosed to be suffering from appendix and needed to be operated on. He noted that his wife continued to have a resurgence of pains years after the surgery, only for additional diagnosis to reveal that one of her kidneys had been removed during the initial surgery. Confirming the incident, the police public relations officer of the Plateau State Police Command, DSP Alabo Alfred, told newsmen that the suspect is currently being detained, adding that investigation is ongoing to determine his culpability to the crime. Also, the Nigerian Medical Association has since disassociated itself from the suspect, stating that he is neither their member or a medical doctor. For decades now, Nigeria's healthcare system has been plagued with the activities of quacks which cut across the whole strata of medical and health practitioners. It is not strange to find pockets of chemists, pharmacies, and even hospitals operating across different high and lowbrow areas of the society without proper certifications and licensing. Neither is it odd to find drugs being hawked around and sold in public places like household commodities. These activities of quacks have left dire consequences on the lives and health of thousands of the citizens. In an interview with Clearview News Desk, some Nigerians recount their near-death experiences in the hands of quacks operating in the country.
There is this pharmacy I went to, though infection was disturbing me because I work in the market, so we do use public toilets sometimes. So I had infection and I had to rush to the pharmacy that he should give me drugs. Then this guy he gave me about 5 drugs and he said I should go home and take everything at once. So I went home. The packet of drugs, I took everything at once, like the way he said it. He said everything would just go. Like the next morning, I'll just be urinating. The next morning, everything I don't have problem again. I said okay. So I bought the drugs about 6,000 naira. I went home, took the drugs. A few minutes later, my eyes started turning me. I started trying to throw up. I couldn't. My body was shaking. I was vibrating. My face was red. People gathered. What happened? I said I took infection drugs and the rest. I was already going. My breath was like heavy. I was struggling to breathe.
2 months back, a friend of mine, he went to a pharmacy around Pape, and he needed drugs for all these deworming drugs. So the nurse there, as in the pharmacist there, the lady gave him 6 tablets of the drugs, which normally you are supposed to take one per each 3 months. So the pharmacist gave it to him 6 drugs. I advised him, he prescribed it for him that he should take it one every day for 6 days. So when he took it, man, the experience was very bad. He spent almost 300,000 treating himself. You need to look at the way he was looking. He was looking very bad. I don't know how to describe it, but it was really a bad experience.
My own relative suffered a deadly surgery. A pregnant woman, I see her died in pain in all those local hospitals in villages because the surgery was carried out very bad, long. It was a wrong surgery. And the woman died. They operated her. They removed 2 twins. And the woman died. The twins also, they died. and I know that that man did not carry the surgery professionally.
I was taking my senior brother, Mr. Fatai Shuremi, to hospital at Abulegba, which they cut his leg, and we are asking the doctors why are they doing mistake and remove his leg, which we cannot find the sponsorship. We buy a lot of drugs, everything is wasted. They cut the two leg, and now we lost my senior brother.
They say the only way to put an end to the long-standing menace is for the federal government and relevant agencies to enforce stringent measures to flush out quacks in the country's healthcare system.
They should ensure that, okay, this person actually went to school, read what he opened his shop for, he's a professional. They shouldn't just allow because I know business or I was a boy, I learn work from my oga, so me sef make I don't sabi drugs. No, they should always have a license. They should go through, they should start going to all these shops like one after the other. They should start like bring proof of payment, your certificate that you went to school, everything, that let us be sure that okay, you actually read this thing.
I would advise the government to like put more effort in the regulation of the medical aspect in the country. Like the regulation has not been well taken care of. Like people go to all these quack places, but at the end of the day they get settled and they just leave the place. So my advice to the Nigerian government is that they should put more efforts in regulating this whole thing.
Nigeria at large, if you hear anything that is not good while you receive treatment, you can actually make report to the medical association and then report to the nearest station if possible.
This minister that have been sworn in now should make sure he take charge properly and direct other medical medicine have to do. It's not only the hospitals, in other places. So even in so-called primary healthcare agents, and health is very, very important. You can't joke with life.
Nigeria's healthcare system is ranked among the poorest in the world, according to a recent World Health Organization survey. The system is marred by corruption, poor facilities, and a limited supply of health practitioners, and this has provided a fertile ground for quacks to thrive. These Nigerians say unless concerted efforts are taken by all stakeholders, especially the government, in tackling the healthcare problems in Nigeria, the decay in the system will continue and medical quackery will continue to thrive. Gloria Atta, reporting for Clearview News.